For decades, it's always been about losing fat to look better. But now, some are saying that fat is in. Just depends on where you want to put it. CBS 11's Tracy KORNET with an explanation.
For 54-year-old Melanie Schreiner of North Richland Hills, the reflection she sees in the mirror is not what it used to be.
Over the years, I have lost a little bit of weight. And as we age, we tend to kind of sink in a little bit in our face.
She'd like to get a more youthful look in the most natural way possible.
Around the eye area, right in here, right up in here, and around the lips.
We look along each of the areas we're going to inject.
That's when Dr. Bill Johnson from Innovations Med Spa recommended a fat transfer procedure, where fat is removed from one part of her body and injected into her face.
From the health point, it just sounds so right, so normal. If it's there in my body anyway, what is it going to hurt to put it somewhere else?
We're trying to restore the fat structures to where they were when they were 20.
The fat transfer procedure is not new. However, the technique being used now is. Dr. Johnson can now get more than 70% of the injected fat cells to stay alive, compared to 40% before.
By how you place the fat, you encourage it to get a new blood supply, and that's the key to getting the fat cells to survive.
Using a picture of Schreiner when she was younger, Dr. Johnson maps out exactly where the problem spots are now.
We say, how much fat do we need to restore the face we're looking at today to the amount of fat it had in that area when that face was 20.
I'm hoping to see more fullness, not quite so much sunken in area.
During the procedure, fat is removed from just above Schreiner's knee. It's then placed into a centrifuge to be drained of excess fluid, and then it's injected into one of close to 80 different points in her face.
There's no chance of reaction because it's your own fat. It's permanent for the fat that survives.
Here is another one of Dr. Johnson's patients before the procedure, and here she is 2 weeks after with fuller lips and cheeks.
Hello, Melanie.
1 week after her procedure, and Schreiner is still swollen and bruised. But she says she can already see a difference and is excited to see how it will turn out.
Just can't wait to look in the mirror and see what it looks like in about 10 days.
The procedure can cost anywhere between $4,000 and $5,000. For more details, go to CBS11TV.com and click on Medical News. Tracy KORNET, CBS 11 News.